Hi, my name's Chloe and I'm your tour guide for today. Welcome to the Swan Hill District Health new emergency department. So the building that we're in now has cost $43 million and it's to provide care to the community for the future. So it's not just about how we provide care now. We're going to be starting working here from Wednesday the 11th, next Wednesday at 8 o'clock. This is our really busy time over Christmas and summer, and we'll open 9 care spaces and 4 fast track areas until we get used to the new area and we know where everything is. And then as we get more nursing, doctor, cleaning and admin staff, then we'll start to open up other areas. So our priority at this stage is to provide safe care when a person is sick, and we're careful about how we work in this new area. So let's go through to the second checkpoint. So this is our fast track area. Behind you, we've got boxes unpacking for a plaster area, ear, nose and throat consulting spaces, and in here, fast track chairs. So this is for this area, or there's different consulting room areas. This is for people who need care or short procedures under 4 hours. It might be stitches, it might be something in your eye, it might be a strained muscle, maybe some bleeding, vomiting, or maybe somebody with an infection. We're going to go to the next stage, but I want you to look on the left-hand side for the family room as we go this way. This is our family room space if you need to have a conversation that's a bit difficult with a doctor or with a nurse, or you've had an upset moment. So just to be aware of this. This is our third checkpoint. So this is our short stay area. These 4 bays, we've got 1, 2, 3 and 4, are for care under 24 hours. We're not going to open this area up until earlier in 2025, but we will do it as soon as we can. People will come here if they need to have follow-up tests, they might have a migraine, they might need some extra support for that under 23 to 24 hours worth of care. So these are our 2 paediatric bays. They're mainly for people under 17 years of age who need care, but the nurse in charge may choose to provide care for other people of different ages in this area too, just depending on what's needed. This is the second one. Come through to the checkpoint 5. Okay, so this is our space for looking after people who are larger. So it's for people who are over 120 kilos and under 275 kilos, with tracking overhead for people who can't move easily. If you look around here, this is our main ED staff station. So this is the main area where staff will check results, they'll make notes, they'll have team discussions about care treatments, and they'll be able to see and look after the patients. So there are 5 general patient bays, 2 paediatric bays, 2 resuscitation bays, and 1 bariatric or larger person bay, and an isolation bay in this space. We'll go through to checkpoint 7. Here we have 2 resuscitation bays. So this is where the sickest patients would be brought to receive care. These patients will usually have a critical illness or an injury. From this area, we can also do portable x-rays and also telehealth to other units for specialist input to the patient's care. This is an isolation room. This room will be set up to provide care to patients who have a contagious disease or need negative pressure. Sorry about the beeping. The area is designed to reduce the risk of an infection spreading, and where standard precautions like gloves and masks are not adequate. It will be used for patients who need airborne precautions like chickenpox, measles, and some respiratory illnesses. Right, checkpoint 9. Okay, so this in here is our safe our safe behaviour assessment room. So this is for patients who have behaviours of concern, violent, aggressive, threatening, hurting themselves, or they might be brought into this area to help them calm down, or for the staff, the nurses, doctors or security guards and ambulance or police to work out a plan of treatment. Once the patient has been assessed and settled, they will be brought into the main ED for treatment. This area has got a direct entry from the ambulance area for ambulance or police to directly enter. This is our ambulance entry, so ambulance and police will access through here where they can directly come through. The nurse in charge or staff in charge can just open the doors. This is our ambulance triage area, and through here we have our triage. So any person who comes into the emergency department is triaged. They're assessed very quickly by a nurse, and that includes if they come in by ambulance or by car or through the front doors. The nurse assigns a triage number to each patient, and this is how the staff then know which order to see the patients according to how sick they are. After you are triaged, you may have to wait to receive further treatment. Just going to keep going through. So we're now back where we started with our paediatric waiting area, our adult waiting area, our reception and the front entry of our triage. The next stage of this project is a 1-year, $12 million project where we knock down the old emergency department and build a bottom floor and first floor. The bottom floor will be the shell of radiology, and the first floor will have community mental health and occupational therapy and hospital avoidance risk program teams all in them. The floor will also have pathology located in it, and we'll be opening it in early 2026. Thank you. We hope we don't have to see you in here sick, but we're also very proud to show you around, and rest assured that if you are sick, we'll be here ready to look after you.